Schizophrenia is a severe mental illness. This illness makes it hard to tell the difference between what is real and what is not. Schizophrenics have trouble thinking clearly and have trouble reacting appropriately to mental and social situations they are put into. This illness affects about 1 to 2% of the world's population. Schizophrenia can develop as early as the age of 5, although it is extremely rare for this illness to show up this young. Men usually become ill between the ages of 16 and 25, and women usually become ill between the ages of 25 and 30. Although they can develop at different times, both men and women are at equal risks of developing this illness. Some symptoms include hallucinations, delusions, disordered thinking, and unusual speech or behavior. In studies, it was noticed that people suffering with schizophrenia have brains that release far more neurotransmitters between neurons. This is what causes symptoms. Newer studies show serotonin, the neurotransmitter, may also play a role in causing some symptoms.
Schizophrenia can affect a person socially as well as mentally. People with schizophrenia often find it hard to relate to others. They can often become withdrawn from society. They believe others are trying to harm them, or they feel like they are constantly being watched. Families that have a member that has been diagnosed with schizophrenia can find it extremely difficult or stressful to live day to day. It is difficult, even sometimes dangerous, to go from activity to activity of a daily life. In response, those suffering with schizophrenia can become withdrawn from family members and the outside world. They may also act out, either from confusion or fear, possibly a combination of both.
People suffering through schizophrenia are also at risk for other physical diseases. This can range from diabetes and obesity to addictions and drug use. They are also at risk of getting or developing tremors, dyslexia, heoplasms, ischemic heart diseases, digestive diseases, chronic respiratory problems, endocrine diseases, connective tissue diseases, and neurological diseases.
Students with schizophrenia may deal with function limitations that have potential to weaken their academic performance. Some examples of function limitations are difficulty with medication side effects, screening out noise, maintaining stamina, handling time pressure or multiple tasks, interacting with others, fear of authority figures, responding negatively to feedback, responding poorly to change, and severe test anxiety. It is up to schools to make accommodations for these students to have equal access and opportunity to learn. Accommodations should not be made if they place a financial burden on the school or if they are a threat to the health of the student. These accommodations should not change essential elements or alter objectives of learning. Just because these accommodations are being placed does not necessarily mean there will be success with the student. Some ways schools can accommodate for these students are by addressing many learning styles, incorporating experimental learning styles, setting behavior expectations, and embracing diversity. Schizophrenic students work best in a structured environment with a set routine. Classroom-specific accommodations may be needed. Some examples of classroom-specific accommodations are preferred seating, most likely by a door in order to step out, assigned classmate, pre-arranged or frequent breaks, allowed use of a tape recorder, photocopy of notes, course materials on disk, and private feedback on performance. In addition to classroom accommodations, assignment accommodations may also be needed. Some examples of assignment accommodations are alternative or substitute assignment, advanced notice, allowed to handwrite instead of type, dramatic formats, extended time, and extra assistance. If needed, exam accommodations may be in order. This would include alternative formats, computer software assistance, extended time, non-distracting room, or increased frequency of exam. It is also important to note all students are entitled to accommodations brought by the American Disability Act of 1990 and 2008.
People diagnosed with schizophrenia have many treatment options, some options being support programs, therapies, or behavioral techniques such as social skill training. One very important aspect of their recovery is job training and relationship building class. Patients have better results when using medication, especially those that target the serotonin and dopamine transmissions in the brain.
Antipsychotic drugs are most commonly used and are most effective. Some side effects of these medications are dizziness, restlessness, sleepiness, and tremors. Family members are also a vital part of recovery. They need skills like coping with symptoms of medication, having a healthy lifestyle, and they need to be able to watch out for returning symptoms.
The following video is of a little girl by the name of January Schofield, also known as Janie. At the time this video was shot, she was about 7 years old. She was diagnosed with schizophrenia at the age of 6. She is currently the youngest person in the United States diagnosed with schizophrenia. This video shows the struggle of living with someone who is battling with schizophrenia. Janie is someone who would receive these special accommodations we have talked about. At the time Janie was going to school, after hours so she could get used to the new environment, she would also meet with teenagers who had the same or similar disease as her. Currently, Janie is 12 years old. To our knowledge, she was taken out of school and put into homeschool due to teachers being unable to handle her.